This video will review the personal protective equipment and proper donning and doffing method for droplet precautions. The personal protective equipment, or PPE, required for droplet precautions are a fluid-resistant gown, a procedure mask, eye protection, and gloves. Prior to donning PPE, please read the isolation sign posted at the door to familiarize yourself with the type of isolation and components of PPE required. To begin, remove jewelry and tie back hair if applicable. First, perform hand hygiene using alcohol-based sanitizer on hands. Rub hands together for a minimum of 15 seconds, ensuring coverage between fingers, around and under nails, on palms, back of hands, thumbs, and wrists. Continue rubbing hands until dry. Take a fluid-resistant isolation gown from the isolation cart. Perform a visual inspection to ensure there is no damage. When putting on the gown, ensure that both the neck and mid-back ties are tied as tightly as possible, so that clothing is fully covered and the gown does not drape when providing care. Place the procedure mask with eye shield on your face. Pull the side elastics behind your ears. Pull the bottom of the mask under your chin while holding the nose area. Mold the metal strip to the bridge of your nose. If you are using goggles or face shield, put this on after your procedure mask. Please note that personal prescription glasses are not an alternative form of eye protection. Put on your gloves. Pull the gloves over the cuffs of the gown so that your wrists are fully covered. You are now ready to enter the room. When you leave the patient's room, remove your PPE, taking your time doffing your PPE correctly to avoid contaminating yourself. First, remove your gloves, using the glove-to-glove, skin-to-skin technique. Pinch one glove and pull the glove down and away with your other gloved hand. Gather the removed glove into your gloved hand. With your bare hand, put your fingers under the glove of your other hand and pull down and away. Throw gloves in the garbage bin. If you think you may have contaminated your hands while removing your gloves, you can perform hand hygiene at this time. Next, remove your gown. Untie both ties at the neck and mid-back. Carefully pull gown from behind shoulders and down your arms away from your body. Fold gown inwards and roll into a ball. Place in a soiled linen cart. Perform hand hygiene for 15 seconds. Remove your procedure mask and eye shield by grabbing elastics at your ears. Remember to avoid touching the front of the mask and eye shield when removing. Pull down and away from face. Place into garbage bin. If you are using reusable goggles or a full face shield, remove before the procedure mask. Once you are finished doffing all of your PPE, please wipe reusable goggles with hospital-approved disinfectant with a clean pair of gloves. Finally, perform hand hygiene for 15 seconds. You are now ready to proceed to your next task.